The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Today on Aging Horizons, we'll be speaking with Kimmy Everman, who's a communications and outreach specialist for the state of Montana, all about Medicare. It's a new year, so we're going to be talking about all the benefits that you should be looking out for, how to make sure that you're getting all the benefits that you need and that you're on the right plans, and all about what was this open enrollment event that just happened and how you can prepare for next year's open enrollment event. So make sure you stay tuned to Aging Horizons.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
No one likes to have to ask for help. It's a courageous act.
Sarah Solomon, Energy Share Coordinator.
Our clients work hard, sometimes at 2 or even 3 jobs, but still struggle to keep the heat on. They're doing everything they can. They're proud and they don't give up. I feel inspired and honored to work together with these Montana families.
To donate, call 888-779-7589 or go to EnergyShareMT.com. Energy Share, you can help your neighbor stay warm.
I have so many questions about power of attorney.
Well, some powers of attorney are for finances and others are for healthcare decisions.
A power of attorney designates an agent who would make decisions on your behalf.
While making a power of attorney, you have the ability to control your agent's power.
You also have the ability to decide when that POA would take effect.
Wait, am I giving away all my rights?
Power of attorney isn't a license to make any decision for you, just those that you've specified.
Your agent should be somebody that's working in your best interest, but it should also be somebody that you would trust.
What if they try to abuse their power?
Protective measures like third-party accounting, secondary signatures, defined spending and gifting limits can help protect against financial exploitation. An agent's powers can always be limited by a customized power of attorney, and they can be revoked by you or the court if the power of attorney is abused.
So carefully drafted estate planning documents can help ensure that your finances are monitored, but not abused.
If you or someone you know is being exploited, please report to Aging Services Bureau at 844-277-9300 or the Legal Service Developer at 1-800-332-2272. This message sponsored by the DPHHS Aging Service Bureau.
Welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm your host, Katie Lovell, and today we'll be speaking with Kimmy Everman, who's a communications and outreach specialist with the state of Montana. So, Kimmy, it's a brand new year.
It is.
And now that it's a brand new year, we've gotten through a lot this last year, and I think a lot of us can use some refreshing on even just basic topics.
Yeah, because I think our brains are turning to mush a little bit.
Right? I know mine hasn't. We've just gotten through Christmas. My brain is mushy.
Yep.
And there's a whole new group of Montanans that are going to turn 65 this year.
Right.
So let's talk about Medicare.
Yeah, let's talk about Medicare because, you mentioned that there was the big open enrollment event, and yeah, that's big and it's a very important deal for Medicare beneficiaries, but the really important part is you get these great benefits, that it's a great value, that you worked to get it all your life, and that you are given that as a benefit because you worked for it. And I think more than ever, Medicare is, I've always said Medicare has a great value and they've been pretty good to be proactive. One of the things that's changing for 2021 is that there's a more permanent structure to the telehealth that they're going to be, or that they offer already. And I know that, I guess I just want to say before we have our discussion that the telehealth is kind of weird to get used to.
Yeah.
I mean, I have to admit, I was skeptical when I had my first one, but it was okay.
Yeah.
And it was so nice to not have to leave my house. It was stormy outside and I could stay home and still talk to my doctor. So that's one of the greatest new things for 2021 with Medicare. But yeah, let's step back and just talk about how do you get Medicare?
Let's take even a farther step. Okay. What is Medicare?
Okay.
Tell me what my brain is so mushy. Kimmy, start from the very beginning.
So Medicare Medicare is a federal insurance coverage, meaning that it's administered out of the federal government, and it comes in a lot of different forms and fashions for folks, but basically, if you've worked 40 credits of work, which comes to about 10 years of full-time work, then you are eligible for full Medicare benefits.
And is that 10 years at once? Is it 10 years
it
throughout
can
your
be
whole
how
life?
as a mom, you know why this is important.
Yeah.
You may have had to stop working for a while with children and things, or maybe you're caring for someone, whatever. You can do the 10 years in whatever way works for you. And the good news is that Social Security is going to take, they're going to follow that for you. You don't have to worry whether, you have to keep track or anything like that. That's what they're going to do for you. Then when you turn 65, you're eligible for Medicare under those circumstances. Medicare is in 4 parts: A, B, C, and D. A is your hospital, so major medical. And if you were going to be buying that outright in 2021, it will be $471 a month.
Wow.
And you're getting that at no cost because you worked for it all your life.
Sure.
So very, very good value right there. Then we have Part B, which is the outpatient type of coverage. And it's got a deductible, it's got a premium each month, but again, a really, really good value. It went to Part B is $148.50 in 2021, and that's only $3.90 more than 2020. And I really wanted to make that point because I want folks to know that they're getting a good value.
Absolutely.
This is great coverage. All right, so then you've got the Part C, which is Medicare Advantage, Medicare Health Plans are also another name for them, and they are a conglomeration of all the parts of Medicare. And I'll come back to that. And then we have Part D, which is the prescription drug coverage piece. So with Part C, what you do is you buy your plan from a private organization, a Humana or a Cigna or somebody like that. You still are a Medicare beneficiary. You're still getting your Medicare federal benefits, but it's being administered by a private organization or a private plan. And because it's a little different than traditional Medicare, you may get some extra benefits through the Medicare Advantage plans. Some have a hearing benefit, some have a vision benefit, some have even a little dental. So you get these sort of extra benefits from the Medicare Advantage plans, and you also get that Part D, which is your drug coverage, mixed in. So it's a real one-stop shop sort of concept.
Sure. All of your eggs in one basket.
Exactly. Yep. And a lot of, and the thing that we just need folks to always remember is lots of choices. So make sure you're looking to see what you're getting. SHIP counselors. We've talked about SHIP counselors so many times on this program, and it's because they are such an important piece to the Medicare puzzle. They're your advocate. They have nothing to sell you. They don't work for a company that wants you to buy something from them. They are your complete objective advocate. And I think we can probably run their number on the screen. Anywhere in the state that you want to call a SHIP counselor, you can call the 1-800 number and get into the area that serves you.
Perfect. And Kimmy, when we come back, I want to talk a little bit about how you apply for Medicare and then how you know what's right for you.
Okay.
So make sure you stay tuned to Aging Horizons because you're not going to want to miss those important updates.
Providing long-term care for someone in need is a labor of love, but it is a labor. Time apart is healthy and necessary both for the caregiver and the person receiving care. It allows each a respite, time to relax and recharge. If you're a long-term caregiver, visit the new Lifespan Respite website. Financial assistance may be available. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it.
I've been shooting since I was young. It's something I've always enjoyed. I wasn't feeling like myself, and my friend noticed. He asked if he could hold onto my guns temporarily. At first, I was a little shocked, but then I agreed. I think he saved my life that day.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare Summary Notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
As Montanans, we're independent and responsible. That's why we've done so well against COVID-19. As we open up, we have to keep it up to protect public health in the 406. We get that, and we've got this.
Welcome back to Aging Horizons. Today we're speaking with Kimmy Everman, who's a communications and outreach specialist with the state of Montana, all about Medicare. So Kimmy, one of the questions I think you probably get the most, or that in general we get the most, is how do you apply for Medicare?
Right. Well, it's pretty easy actually. Social Security is the application point for Medicare. And so once you turn 65, you're gonna probably go online and take a look there at what the process is, and that's that's especially in COVID times. That's what they want you to do, is use their online applications. There's some decisions to make though about that, because so many more people at 65 are remaining employed.
Sure. Yeah, still in the workforce.
Exactly. And they may have full coverage for their health insurance already. What do you do?
Yeah.
Well, the thing that you do is you don't just not take your Medicare. You talk to a SHIP counselor who helps you figure out, where, like, are you getting ready to retire? Have you got a plan in place? Are you just going to continue to work for a while? Whatever it is. But what we want to do then is, in a way, put your Medicare on hold. Just a little. If you have full insurance through your employer, and it's as good as or better than Medicare, then you are completely fine to stay in that and not take on Medicare benefits in full, and you won't lose anything. You won't be there's no kind of penalty or anything like that. And so you can then use that as a secondary insurance. Okay. And that's kind of nice, because then your main one is going to cover most of your stuff, and then your secondary will come in and cover some of the things after that. And that's a kind of a nice way to wrap up your work career anyway. All right. Then when you get to the end of that, again, you're going to talk to a SHIP counselor in advance. You have some windows of time that you can actually sign up for Medicare and then seamlessly move over from your old insurance. And so you want to talk to, a lot of the situations are different. Everybody's got a unique situation. That's why you don't want to just sort of look it up. You want to talk to a SHIP counselor.
Yeah, that can be really hard to understand.
Exactly.
A little confusing.
Exactly.
Yeah.
And so, maybe 8 months or so before you think you're going to retire, you might want to get in touch with a SHIP counselor. And again, we can put their number up on the screen. And just say, I'm getting ready. This is the month I want to go. Can you help direct me? And that's exactly what they will do. And that'll give you an idea of just when to move over.
Okay.
Okay.
So now we're on Medicare.
Okay.
Or we're signing up. We know how to do that.
Yep.
How do we know what to choose?
Yes,
how do we
'cause
know
there's
which
a lot.
basket to put our eggs in?
Yeah. I mean, just in 2021 alone in Montana, there's like 41 to 45 different Part D plans available. That's a lot to choose from.
That's so many choices.
Exactly. All right. So the first thing is that you want to decide, okay, do I want traditional model Medicare or do I want that Medicare Advantage we talked about? Traditional model is just A, B, D. So hospitalization, outpatient, and your coverage for your meds, and any doc that takes Medicare, you can go to that doc and use your Medicare there. You can also pick a Medicare Advantage plan. And again, that's going to be through a private organization, so you're going to want to pick one of those based on what's in your community, what the extra benefits are that are appealing to you, and where, very importantly, where your providers even are. You know, and in Montana, that's a big question.
Yeah.
You may sign up for a Medicare Advantage plan in Missoula and it's fine. The same plan in 2DOT is very different. Exactly. Again, that's why you need to talk to a SHIP counselor, because they can help you see where your providers are actually located, and just talk you through how you think you're going to use those benefits.
Sure. And another super important thing to bring to that visit is your medication list, so they can help you pick the right Part D plan.
Exactly, especially to start with, because once you're in a Part D plan, the plan finder tool that's available is so great and will help you guide you from year to year. But to start with, you need to have that list, and remember that things like dosages and those are all very important to what's going to come up on the plan finder in terms of what's right for you. So, and I'll just say a tiny bit about the plan finder. The plan finder is a tool that Medicare has put together that's a wonderful, wonderful tool. You go there on the computer, you put your meds into the plan finder, you push submit, and then it comes back with the suggestions for a provider based on the information you put in.
That's wonderful.
It's very, very individual.
That's so helpful as a tool, especially in Montana, where sometimes our access to healthcare can be pretty limited just by distance even. So that's wonderful. Well, Kimmy, when we get back, I want to talk a little bit about some of the yearly benefits that people may not know about, things that they can have access to every year as a Medicare beneficiary. I know that we do these talks a lot, and I think that that's such an important one because there are so many screenings that really help advance our health that are so important for Medicare beneficiaries to really be taking advantage of. And just, you know, one more time, those SHIP counselors are so good at helping us
And
find
we'll talk
those.
about helping programs.
Yes, absolutely. We can't forget to talk about helping programs. So when we get back, we're going to talk a little bit about the helping programs that can help you pay for the Medicare costs that are out of pocket that may be a little bit overwhelming for you. And we're also going to talk about the yearly programs that we want to make sure that you're getting out of your benefits. So make sure you stay tuned to Aging Horizons.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
You mean I can get help paying my prescription drug premiums?
Let me get this straight. I could be eligible for help with my family's prescription premiums even though I own my own home?
And our assets won't be counted.
If you're a Montana resident enrolled in the Medicare prescription drug program, you could be eligible for help paying your premiums. Call or visit the Big Sky RX website today to find out, even if you think you're over income.
What do you know about that? I'm eligible.
I was outside working on some equipment, nothing too strenuous. I started sweating and feeling out of breath.
When he felt pressure in his chest and aching in his arms, I knew we had to call 911.
First responders were there before we knew it. 38 minutes later, the doctors had restored the blood flow to my heart.
Now we know dialing 911 saved his life.
Your life is on the line.
This message sponsored by Mission Lifeline, Montana.
When I found out it was diabetes, my first thought was, Barb, you need help. You have to take control of this. There is help. My doctor gave me a phone number. I called and signed up with a diabetes educator. There is help. I have to put blinders on when I walk past the bakery counter. I can feel my blood sugar go up. You succeed a little at a time. If you have diabetes, help is available. You do not have to do it alone.
Ask your doctor about diabetes education or visit montana211.org.
Welcome back to Aging Horizons. Today we're speaking with Kimmy Everman, who's a communications and outreach specialist with the state of Montana, and we're talking all about Medicare. So Kimmy, just as a refresher, there is traditional Medicaid, Medicare.
Right.
See,
right.
My brain is already mushy. And we're talking about the Medicare Advantage plan. So give me a 30-second recap, and then we'll go on.
Okay. So because this is really important, and your brain isn't mushy, it's really it's one of those things that's kind of hard to grasp onto until maybe you've looked at it for a bit. But there's a traditional model of Medicare, and you get A, B, and D with the traditional model, and that's outpatient, inpatient, and medication. Or there's Medicare Advantage, which is a conglomeration of all the parts of Medicare put kind of together. We call it a one-stop shop, but also it can be thought of as a wraparound plan as well. Now, I just want to go back to the traditional model for just a second and say one thing we haven't talked about is the traditional model. You can buy a supplemental insurance policy to go with it, or a med sup, is what, a medical supplemental. Or Medicare supplemental. That's a very individual kind of decision and a very individual situation in terms of the kind of coverage that you might need.
Sure.
But really, in a nutshell, what a med sub does is it helps be a wraparound as well, where it'll pick up some of the out-of-pocket costs for that person for that monthly premium. Okay. So if you decide that that's what you want to do, it's very important that you talk to your insurance agent.
Okay.
That isn't something we want our SHIP counselors to have to bear. Is help somebody buy their insurance in a way like that. It's too individual, and it's too much for that person to have to really take on themselves.
Okay. All right. Talk to your insurance agent about those.
Yep.
Okay. So let's talk a little bit about the helping programs, because right now this is a time where a lot of people in the United States are struggling. So we may need some assistance in covering some of those premiums. Where do people go when they need help?
Right. Well, SHIP counselors. And I don't mean to be flip, because this is really, this is their bailiwick, is advocacy for Medicare beneficiaries. And there's three helping programs. One is called the Low Income Subsidy, or LIS, and that is specific to the Part D piece of Medicare, and it helps pay premiums, and it helps pay out-of-pocket expenses. It maybe helps keep the drug prices lower depending on your eligibility level. So that's one of the helping programs. And to get that helping program, you need to talk to, probably a SHIP counselor, and they can help you apply. But it's got a number of levels, so that you may be eligible for a partial benefit, even if you're not eligible for the whole benefit.
Okay.
So it's completely worth it to check it out, just to make sure. So that's the low income subsidy. And then we also have MSP, which is the Medicare Savings Program. And that is a program specifically for Part B of Medicare. The outpatient piece of Medicare, and it helps pay the premiums and again the out-of-pocket expenses that maybe people have, and again several levels of that program are available so that you may be eligible even if you're not eligible for, the full benefit. And then we have Big Sky RX, and Big Sky RX is a plan that, or a benefit that helps with Part D only. And it pays just a premium each month.
Okay.
Based on financial eligibility, it's a little bit higher, so you might be able to be eligible for that program when you haven't been eligible for other programs before. Again, worth checking out.
Absolutely worth checking
Yeah,
out.
and talking to your SHIP counselor about that. And then finally, there's Medicare and Medicaid. And we don't want to get too far into that other than to say that some people on Medicare also are on Medicaid. They're extremely low income, they're extremely ill and disadvantaged. And those folks get benefits and coverage that help them, kind of work through the world.
Sure.
And they can certainly talk to a SHIP counselor about that, but they may also want to talk to someone at the Office of Public Assistance.
Sure, absolutely. So, Kimmy, now that it's a new year, there are some programs that Medicare beneficiaries should be taking advantage of every year.
Right.
Let's talk about a few of those.
Yeah, immunizations for sure.
Yeah, absolutely.
With the COVID vaccine coming around the corner, it makes us think even more about get your flu shot.
Sure.
Don't forget to do that. Get your pneumonia shot. Shingles.
Yeah,
absolutely.
I mean,
there's these immunizations you can get through Medicare that are just so proactive.
Yeah.
There's also things like mammograms, colonoscopies, cessation of smoking. There's cognitive kinds of things that, like testing that they'll do as a baseline in the wellness exams.
Sure.
So, and that's another couple, the wellness and the wellness exam and the Welcome to Medicare exams.
Yeah.
Both very important benefits to use as soon as you get them.
Absolutely. I have young children and they do the well baby visits. This is sort of
Yeah.
what you get at the opposite end of your life. I think
Yeah.
they're so important to really to give you that baseline for your health every year. So important.
Exactly. And I think it's important because it helps folks continue to live in their homes.
Yeah.
If they know ahead of time what's going on, there's a lot better chance you can handle it.
Absolutely.
And stick with whatever your plan was.
And it's just so nice to have someone have eyes on you,
yeah.
on a regular basis. And now you might get to do it on the couch in your pajamas. 'cause we're
Exactly.
doing telehealth
And I
now.
tell you what, as I said, I was skeptical, but I'm a believer now. I like
haven't
them.
missed waiting rooms at all.
Well, and you don't get wait every time.
Right, exactly. It's wonderful. Yeah, it's pretty great.
Yeah.
So, Kimmy, I think as a takeaway, it's always just call your SHIP counselor. If you have questions, if you need assistance, if you need support, call the SHIP counselor.
Yeah, and if they don't know, they'll find out for you. If they're not the right person, they'll direct you in the way you need to go.
Absolutely.
So it's a win-win-win.
A win-win-win. That's exactly it. SHIP counselor is a win-win-win.
Right.
Well, thank you so much for staying tuned to today's Aging Horizons. I hope you learned as much as I did, and make sure you're calling your SHIP counselor.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.